Hello, I'm Dr. Leone. I'd like to spend a few minutes in this short video going over the Leone surgical system and its surgical kit. The Leone system is an Italian implant system distributed in North America and many other countries as well. First of all, this kit is designed to place their 4 standard diameter implants. The smallest diameter implant that they have available is a 3.3 diameter implant. And the color coding is green in color, both in their surgical kit and in their packaging for the implant and its component parts. So again, the small diameter implant is 3.3 millimeters in diameter. The second implant available is 4.1 millimeters in diameter, and the packaging color is yellow. And the third diameter implant is a 4.8 millimeter diameter implant, and their color coding is red in the packaging. They also have a fuchsia or a pink colored implant, diameter of 5 millimeters and length of 6.5. So it's an individual implant that's 5 millimeters in diameter, 6.5 in length. The other 3 standard implants that they sell have lengths in the implant of 8, 10, 12, and 14 millimeters in lengths with the 3 different diameters. An overview of the system itself: the upper row is the drills used to make the osteotomy for the implant diameters. Over on the right is the countersink, the 3.3, the 4.1, and the 4.8 countersink used prior to placement of the implant to expand the cortical bone at crest of ridge. A measuring system that we'll discuss in more detail as we go along. Taps for the 3.3, the 4.1, and the 4.8 implants. The drills used for the wide diameter implant are pictured here in the lower left, and taps associated with that implant. In the middle we have some parallel pins, and above the parallel pins is a hand screwdriver used to place the implant by hand. To the right of that is a hex head extractor for healing cap, and this instrument is used to remove the healing cap in the restorative phase. To the right of that is the instrument for the cover cap. This instrument is used to place on the healing cap or cover cap once the implant's inserted. To the right of that is the driver for the implant. When placing the implant, once the transfer is removed, this driver can be inserted into the implant and placed in the osteotomy with either the ratchet or the hand screwdriver. To the right of that is the extension, and this extension can be placed on the ratchet or on the hand screwdriver to work in spaces that are limited between adjacent teeth. So it's simply an extension to the ratchet or the hand screwdriver. To the right of that is the handpiece adapter, and that handpiece adapter is designed to be placed in the motor-driven handpiece, and the implant's attached to the end of that and can be placed in the osteotomy with the motor-driven handpiece. That's an overall view of the kit itself. Let's now go over each individual component. Back to the upper left, the first drill in the drill sequence is a round burr, and the round burr is designed to make a purchase on the bone so that these other drills will not slip off the bone when inserting them to do the osteotomy. So the round burr is simply there to start the purchase for the initial osteotomy. Pilot drill, or the first drill in the sequence, is color-coded blue. They have both a short and a long drill. The short drills are 33 millimeters in length, and the long drills are 39 millimeters in length. And that distance is consistent throughout the drilling sequence with all the different diameter drills. So back to the drilling sequence. The round burr is generally used first to make a purchase. The pilot drill is the next drill to be used, and that's a 2.2 millimeter diameter drill. And I know it's difficult to read the laser lines on the drill themselves, but the laser lines correspond to the length of the implants. So the laser line closest to the tip of the drill is 6.5 millimeters in length for the 6.5 length implant. The second laser line is 8 millimeters, the third is 10, the fourth is 12, and the last line is 14 millimeters, corresponding to that length implant. So following the pilot drill, the next drill in the sequence is the 2.8 drill, which is green in color, and that matches the green colored implant that will be placed, the 3.3 diameter implant. So if you're placing a 3.3 implant, the sequence would be round burr, pilot drill, final drill. For the 3.3 implant is a 2.8 diameter drill. Correspondingly, if you're placing the 4.1 implant diameter, you would use one more drill in the sequence, yellow drill, yellow implant. And the third diameter implant, the 4.8 implant, the final drill would be the 4.2 drill, either short or long, prior to placing the implant. So this entire row is designed to place their 3 diameter implants from 3.3 to 4.8. To the right of the drills are 3 more instruments, and they're called countersinks. These countersinks are designed to widen the osteotomy site at the cortical bone, and there's another laser line here. These are placed in the osteotomy after the final drill, and they're made somewhat wider at the cortical bone to make insertion of the implant somewhat easier. So they profile or countersink the crestal bone at the top of the osteotomy. If you were placing a 3.3 implant, this would be your final drill, followed by the countersink prior to insertion of the implant. If you're placing a 4.8 implant, your final drill, followed by the 4.8 countersink, and then placement of the implant. That's the drilling sequence for the 3 diameter implants, 3.3, 4.1, and 4.8. In the lower left corner of the surgical tray, these are the drills that are used to place the 5 millimeter diameter implant, 6.5 in length. There are 3 drills and 2 taps. These drills also have stops on the drills. In other words, when this area of the drill hits the cortical bone, it stops, and that gives you a defined 6.5 millimeter length osteotomy. So these are drills with stops. So the sequence of drilling for the 5 millimeter diameter implant is the 2.2 drill until you hit the stop, the 2.8 drill until it hits the stop, followed by the 3.5 drill, and then either use the tap to thread the osteotomy or simply place the implant. In a hard bone profile, the taps are used. In soft bone, the taps are not used prior to implant placement. But these drills on the upper place the 3.3, the 4.1, and the 4.8 implant, and these drills and taps on the lower place the 5 millimeter diameter implant. This is just a metal basin to place instruments during the drilling sequence if you desire. This measuring component of the surgical kit is used to help measure the depth during the osteotomy portion of the surgical event. Let's say, for example, you want to place a 4.1 diameter implant, the yellow coated system. If you were using the short or the long drill, and you wanted to place a depth stop on the drills, you simply remove the drill from the kit. It's a yellow drill. Place a ringlet on the yellow drill like so. And if you're placing a 4.1 implant and you want to place it in a 12 millimeter length implant in the osteotomy, you simply place the ringlet on the end of the drill, go to 12 millimeters, the yellow coated system and slide the ringlet down until it hits the full depth of the surgical kit. When you pull this now out of the depth gauge, you know that this point, the bottom of that ringlet, is 12 millimeters for a 12 millimeter length implant from the end. So you visually then can use this as your guide during the surgical event. And obviously the 3.3 diameter implant could be done the same way. It would be the green drill, 3.3 up to 12 millimeters. The 2.8 drill then would give you the depth mark for that implant to be placed. Next to the various depth stops is the depth gauge. And the depth gauge is measured from the end to correspond also with the implants. Goes from 6.5 on the first laser line up to 18 millimeters on the top laser line. So again, this can be used to check your depth of the osteotomy. To the right of that, we have the taps. And these taps are not always used when you place the implant, but they're always used when you have a dense bone situation. The 3.3 countersink would be followed then by the 3.3 tap prior to placement of the implant in the hard bone profile type of osteotomy. The 4.1 taps again would be used after the 4.1 countersink in a hard bone profile. They come in both short and long lengths. These are rotated in the osteotomy prior to the implant placement, and because they're tapping devices, they need to be rotated counterclockwise back out of the osteotomy before placement of the implant. Down here in the bottom row, this is the hand screwdriver, and this is the instrument that can be used to place the implant after the osteotomy is complete. So the implant would attach to this part of the hand screwdriver, and you could start to place the implant by hand. Another option to place the implant would be obviously with a ratchet or a handpiece adapter that we'll cover here in a second. Below the hand screwdriver are 3 parallel pins that can be used to help parallel each implant if you're doing a freehand type of placement. To the right of the parallel pins is a hex head extractor for healing caps, and this is an instrument that is used to remove the healing caps after the second stage surgery and the patient's ready to be restored. The end of this fits into the healing cap, rotated 10-20 degrees, and the healing cap then is removed. Just to the right of that is the instrument for cover cap. When the implant is purchased, what comes inside the packaging is the implant and the cover screw or cover cap, and this is the instrument used to place that cover cap and remove it after healing. To the right of that is the driver for the implant, and this driver is designed to seat the implant once the transfer is taken off of the implant. So again, it's a driver that can be attached to the hand screwdriver. It's also can be attached to the ratchet. This end of the driver goes into the inside of the implant after the transfer is removed, and final placement depth is then driven by the handpiece, the ratchet, or the hand screwdriver. To the right of that is the extension. This extension again goes into the ratchet or goes into the hand screwdriver, and it's designed to be used in those spaces where you have close adjacent teeth and you need an extension to get the thicker part of the instruments away from the implant. To the right of that is the handpiece adapter, and the handpiece adapter goes into the motor-driven handpiece, and the implant can be attached to this end, the implant carrier, and the implant driven into the osteotomy with a motor-driven handpiece. That's a summary of the parts and pieces in the surgical kit. In the next short video, I will show you how to use these component parts to make an osteotomy in a model and place the implant using the parts you see here in that model. Thanks for watching the video.